Sunita talking tonight about Thrive, a healthy work environment project in a pediatric intensive care unit. And so we are just thankful that you're willing to train us in this and talk to us about this. And we know we'll just learn a lot. So I'll just go ahead and turn it over to you.
Awesome, thank you. Okay, I'm just gonna share my presentation here. All right, and I will be perfectly honest and say I'm not very good at managing the chat. So if anybody has something that they feel free to interrupt me first of all, but also if anyone sees that there's a question that's asked, feel free to also interrupt me and happy to talk about that. I love talking about this project. I'm proud of it, and I'm also I think that this work is something that I would love to spread as far and wide as I can. So yeah, I am really excited to talk about it. So yeah, my name is Sunita, and I'm here to talk about Thrive, which is a project that I did in a pediatric intensive care unit at a level 1 trauma center. The project, Thrive stands for Teamwork, Harmony, Resilience, Innovation, Values, and Empowerment. And I'll confess that I used ChatGPT to help me with figuring out what to make as the name for this. And Thrive it's just such a I love using this name because I love what it evokes, that just this idea of thriving, that I think saying that over and over again, it just has an effect on you. So I'll just keep saying it, and hopefully we'll all feel like we're thriving a little bit as we go through this talk. So my goal today is that I'm going to talk to you about this program, talk about the why for me, for why I started this, and what its impact was in my workplace, and then hopefully give you all some tools that you can use if you wanted to do something like this in your own space. So, this project, I was able to apply at my workplace for a well-being grant. So I had funding to have devoted time to work on this, which was really great because I could really invest a lot into it. It was a combination of using this 5-stage process, which is essentially our quality improvement process, and with a few caveats, as well as the American Association of Critical Care Nurses Healthy Work Environment Standards. I implemented that in the PICU. It was an interdisciplinary project, and something very important to me was that all voices, anyone who stepped foot inside of the PICU, their voice was sought out and made to feel like it really mattered in creating solutions and working on this project. So, my why. Why did I want to work on workplace culture and well-being in my workplace? So, I will say I've been a pediatric intensive care nurse for 5 years, and when I first started, I would say it was a little rocky. And I had kind of a rough time when I first started. And I really didn't have words to describe what it was that I was experiencing. And I really just thought, oh, I'm just not getting this, or my coworkers don't like me, or things like that. That I put it on me as the problem. But then, about a year in, I started training in nurses, and I noticed that these nurses were expressing similar things, but they were going about it a little bit differently. They were talking about it in ways where I realized, oh, it wasn't me that was the problem. This is a systemic thing. This is a culture thing. And this is a thing that's going to make it so people don't want to be nurses and don't want to work here. And realizing the systemic issues that were occurring, particularly with newer nurses on orientation, I just realized that this was bigger and it was going to make it so, yes, people didn't want to work, and it just And then, yeah, it was making it so people didn't even know if they wanted to be nurses anymore. And that's just heartbreaking. So that was my why. And then I started looking into what you really could do to address things like this. And some of the things that I found were the American Association of Critical Care Nurses Healthy Work Environment Standards. And so those standards are listed here. And I will say I am a disciple for the Healthy Work Environment Standards. I think I love these standards. I think that there's a lot of research to back them up, and I just think they can be used in so many spaces, not even an ICU setting. I think they really fit in many other places. So the standards include skilled communication, true collaboration, effective decision making, appropriate staffing, meaningful recognition, and authentic leadership. And these, did someone say something? Okay. And these standards live inside, there's just kind of this bubble where that includes, if you have a healthy workplace and then you include that with clinical excellence, then that should overlap with really incredible and optimal patient outcomes. And I'll just say, I think it probably goes without saying, but a healthy work environment creates a safe, healing, and humane space that is respectful of the rights and contributions of all. It's collaborative and patient focused, and nurses and other healthcare professionals can provide their optimal contribution towards high quality patient and family care. And healthcare professionals can derive fulfillment from their work when a place is focused on, yeah, when a work environment is healthy. All right. So the 5-stage process, which I'm sure many of you see as similar to generally quality improvement process. But so it starts with building a work group, and I'm going to kind of go through how I went through this entire process here. But building a work group, then assessing the environment, implementing a project, evaluating and using the PDSA cycle, and then finding ways to embed and sustain. So in this building a work group, step 1, I would say there were 3 key things that were really important. The first was looking for positive deviance. And I know that that term positive deviant sounds kind of has a little bit of a negative connotation, but it's actually the exact opposite. So it comes from there's an entire book about it, but the idea of a positive deviant, it came from these group of people who were actually trying to solve malnutrition. I believe it was in Vietnam, but so they were in this space, and what they were looking for is trying to figure out how they could, on a really low budget, solve malnutrition for children in this country. And what they did is they found that some kids were healthy in the same environment where majority of the kids were not doing well. So what they did is they figured out what it was that was allowing those kids to be healthy. And in this scenario, it ended up being that the parents were feeding their kids the little fish in the rice paddies, the little shrimp in the rice paddies, and that was allowing them to grow and be healthy. And then so they found ways to share. So those kids that are thriving and doing well, they're the positive deviants. The actions that their parents were doing to allow them to do well in an environment where other people are struggling. So utilizing this idea of a positive deviant, they in that scenario, they shared that with everyone and with as many people as they could. And so that was implemented with families all over. And so that actually helped this situation of malnourishment across the country, which was pretty incredible. So my hope was that I could look for, in this case, the people on orientation in my unit that were doing well when other people were maybe struggling, and what they were doing that was allowing them to thrive. So I was seeking out people on my team who were these positive deviants, the ones who were doing really, really well in this environment where it's very hard to do well in. Next, I tried to make sure everyone's voice was represented. So I invited people from the environmental services team to be a part of this group. I invited physicians, I invited residents, I invited our unit chaplain, I invited our child life specialist. I invited nurses that had many years of experience, and I invited nurses that were brand new. I invited our secretaries, our nurse managers, everyone that was involved in the running of this unit was invited to be a part of this project. The next thing, did someone have a question? No, okay. So, the next thing was to find the people that maybe if I invited them to say something, they didn't. Or if I'm inviting as many people as I can to speak up about maybe what could be the issue here, is there a certain group of people that is not volunteering information? And for me, that group that was silent was nurses that were working on this unit for 20 plus years. And I think a lot of that is because, they were benefiting from the culture that, and maybe felt a little bit attacked by wanting to change something when they've been, you know, participating in this for a while and feeling like if I'm saying something is wrong here, does that mean that I've been doing something wrong for this amount of time? And I mean, that's just not the right perspective to have about it. It's let's all continue this process of getting better and improving, but it's harder to help someone come along with you if you don't try to seek out and find and understand where they're at in the first place. All right. So, in identifying what the problem actually was, there are a few options that you can select for looking at what are problems in a work environment. So one of them is this activity where you could do it in a setting like professional development days or competencies, or a day where there are majority of the people that work in this environment present. And it's an opportunity for people to just list out kind of what are your hopes for what's the best, what's the best case scenario of what this workplace would look like. And then what are your fears about what could be the worst case scenario? And then you go and look at strictly behaviors. What are the healthy behaviors that are occurring on your unit, and stick to the behaviors. You have to do that. And then list out what are the harmful behaviors that are occurring. And so then you survey and figure out what people are saying are healthy versus harmful, and you find ways to emphasize those healthy behaviors and minimize the harmful ones, and then you would resurvey at the end. Also, the American Association of Critical Care Nurses actually has a assessment tool that they've developed that you can utilize as well, which, like I said, I really think that although I did implement it in an ICU setting, I float to other units and things like that, and I just would really say that these standards fit for other areas. Another thing to do is, I try to be biased towards action. And if you feel like doing a survey or organizing all of that is too much and not manageable, then you can pick a single issue that you know to be a problem and just work on that with the work group that you develop. So in my workspace, things that ended up being big issues was high levels of burnout. Some specific harmful behaviors were happening, people were not talking directly to each other, and there was actually just a lack of skills for communication. So I sent out a really big survey, and those harmful behaviors that question was included in this survey. And what people listed as being the most frequent and the most harmful were individuals needing to prove themselves before being treated like a team member by more senior staff, gossiping, constant complaining, laziness, not offering or willing to help, a negative attitude, and people of higher ranking positions or more experience are more valued. And then passive aggressive behavior was also included. So that's kind of it feels hard to tackle when those are the things that people listed as being harmful and also occurring frequently. Another thing that I included in the survey that I sent out was this perception survey, this approachability survey. That's what I'll use. But these two questions I found to be actually really impactful in the intervention that I did as well. So the question of, I would approach a person using harmful behavior towards me. About a third of the respondents said they would not. But then if I'm perceived as using harmful behavior or disrespectful or annoying behavior, I want to be approached. And a majority, 96% of respondents said they did want to be approached. And I think this was really powerful to just blast throughout the unit because it indicated that there wasn't actually an intent to harm behind behaviors, which means that people want to know if they're doing something that's perceived as harmful because they don't actually mean to be harmful, and they would maybe like to change that behavior if they knew that it was harmful, if that makes sense. So I also surveyed the staff and found that we were about 50% burnt out, which obviously being burnt out impacts your behavior and how you act. And I think coming from a lens of empathy with burnout is really important and helpful. So I also, using these healthy work environment standards, so you can score between 1 being completely unhealthy to 6 being like the healthiest possible. So our pre-survey results was that we were moderately healthy overall. And then the way that I mean, I got a lot of data from this, so it was kind of hard to pick out what you want to focus on. And so I selected our 2 lowest scoring standards to address, and those were skilled communication and true collaboration as the individual standards. So thankfully, those are very interwoven things, and I started off by trying to develop skills with communication between staff to allow for us to collaborate better, both between nurses and across the entire continuum of care providers. So developing the solutions was honestly so much fun. I had a blast. I invited all of these people together, and we sat in this room, and I think I'm really grateful that I had people that really cared about this. I got some really good buy-in with this project. So people came really passionate and they came really prepared. And we came and we did this brainstorming session. I used this thing called the Walt Disney method. I don't know if anyone's heard of it, but it involves a lot of sticky notes, and there's a timer, and it's just really reducing the limitations that you can kind of put in your brain on what could be a solution versus not. And there's some designated times on let's see, on these kind of different frames of thought. And if at the end, I think I don't have enough time to talk about this too in depth, but you have some set amount of times to be in the mindset of a dreamer, realist, and critic. And all of it will allow people to kind of talk through how to make solutions happen. And we ended up, by the end of using this method, with more than 100 ideas on what we could possibly do to address the problems that we listed. Another thing that we did in this brainstorming session is, and I know this isn't like the greatest picture, but we talked about our hopes for the unit and what we really wanted. So people enjoy coming to work, better bonds between nurses that are new and old and or experienced or new to the unit, and have this impact be lasting. And fears would be that either this project wouldn't work or it would, or worse, it would not work, and then it would make people not actually want to do something like this ever again. And then we talked about what was meaningful, what's our biggest, we talked about what we felt like was the biggest sticking point here and what could, if we changed that thing, if that would be kind of solve most of our problems. And then we set some reminders at the beginning. So this would be a safe space. All voices have equal value. Be kind, be honest, be brave, and listen mindfully. And I would say setting that stage before we started the brainstorming session was really, really helpful in creating a place where we really worked hard together. So once we picked a few things that we were going to implement, when we developed these, well, so in the choosing process, we had some voting that happened, but then when we really developed things, we made those SMART goals and smart, yeah, solutions. And the biggest thing with having I only had 3 months to implement a lot of these projects because of the timeline with the grant. So really what we did is picked the things that that already existed and then just enhanced them. And I would argue, I mean, yes, I've really only worked at my one institution, but I would argue that most places have a lot of existing infrastructure that you can lean on that are they just need a little enhancing or slight modification. And I'm a big believer in not reinventing the wheel and leaning in on those things and just adding to them. So we had, I found some great resources on learning how to give and receive feedback that were already developed at my institution. And I just blasted them and I shared them with as many people as possible. And I found this whole entire section of um, coaches that exist that I could have utilized for free that nobody knew about. And I utilized them to help with our unit in coaching us on how to communicate well together. And then I leaned really heavily on the committees and councils that existed and found ways where they could kind of adopt things that would live on beyond the project and beyond my being there. Another thing that I developed was these posters that I had posted throughout the unit. And a lot of this, so this all goes back to working on that ability to give feedback effectively. So this, if we follow through this little decision tree here, starting with assuming good intentions, start with that belief that the person is not intentionally trying to cause harm after, yeah, this opportunity, this experience happens where you need to give feedback to somebody. So this is related specifically to wanting to give someone feedback on how they can improve their patient care. So the next thing here is, can you intervene in the moment? Do you need to address the concern quickly for patient safety? If you do, then there are some algorithms that, again, already existed. This was language that already lives in the place where I work. So these cuss words, which is state your concern, uncomfortable, and then you could advance all the way to safety. This is a safety issue. And those are kind of like alarm signals that someone should know. And I thought that this was information that everybody already knew, because that was information that I learned when I was on orientation. But actually, about half the people, when I posted this across, they were like, oh, I had never heard about those cuss words before. And so it's just interesting that, you don't realize that you're not necessarily on a level playing field. People come in with different knowledge as orientation changes and whatever the training programs are change as you evolve throughout. I mean, it's a evolving process, hiring new staff and things like that. So kind of laying that groundwork and creating that level playing field was really helpful. And then I found a TED Talk that talks about a 4-step guide that is research based on how to give feedback. And so if you don't need to necessarily intervene in the moment or you don't feel comfortable, then taking time to reflect on how to give, on what you're going to say when you go and give feedback. And then I've got this guide on how to develop it in a way that makes it so people aren't going to feel really defensive when you start talking to them, or they won't even make sure that people realize that you're giving them feedback, because sometimes people don't actually even realize that that is what you're trying to do there. So this I feel like was really key, and I did a lot of training with people on how to actually utilize this because it seems pretty straightforward, but it can be kind of tricky picking out what the data point actually is that you want to use for um, how to make it really an objective observation on the feedback that you're giving rather than turning it into something that could emotionally trigger somebody. And it might still emotionally trigger people, but they still oftentimes really need to hear it. So another version of this is if you feel actually disrespected by the something that someone says. It's not necessarily needing to give feedback about patient care. It's needing, like, you have hurt my feelings by something that has been done. So we the things that have stayed the same in this decision tree is assuming good intentions, but then looking at, do you feel comfortable talking to this person? And really the conclusion is, from working through all of this, is eventually you do need to talk to the person. However, if you don't feel comfortable at first, you can go through a coach, and that coach could be your manager. It could be people that were, so there were some decided people who would be coaches on how to have that feedback conversation on the unit. And yeah, so really there's opportunities to talk it through and think through how you're gonna give that feedback to somebody, but really the best way to move forward is to not triangulate and make sure that the feedback gets directly to the person that it needs to be given to. And then I would say in our brainstorming session, something that was really helpful, this little bad day checkbox, our unit chaplain, when we were looking at all of this data and talking about what was the problem in our unit, he was like, a lot of this goes back to the idea that there's burnout and people are struggling. And if someone talks to you in a way that seems kind of sideways, maybe they're just having a bad day and they really need to be checked in on. And I just thought that was a really great lens to, and I thought it was really important to add to this poster so that we could all be more empathetic towards each other, especially in a place like an ICU where a lot of sad and hard things happen at work, but then you've got your whole life outside of work too that oftentimes can be hard. And yeah, so I was really proud of this poster and I felt like it was helpful on the unit. So I did a few training sessions with the staff. So here's just kind of an example of a scenario that I created. So you walk into your patient's room at the start of your shift and you receive handoff. There's almost no supply stocked in the cart. The patient's sheets are soiled, the garbage is full, and supplies are all over the room. The outgoing nurse did not report a particularly busy shift, but you'll be giving the patient back to that nurse tonight. So if you wanted to give feedback, what would be the data point that you would use? What is the impact of the behavior of that nurse? And how can you have this conversation happen without making them defensive? So it was really fun to be able to have these conversations with people and talk about really the nitty gritty on how to give feedback really effectively. Because especially with like something that's not, it's kind of hard to talk, tell somebody that you can't really just say, hey, you left this place in a mess. You have to, bring it back to how that impacts patient care and how something, there was a specific thing that happened that made it difficult for you to do your job, and to bring it back to that, and all wanting us to, meet the needs of the patient. So another intervention that I did, and I think there are a few people that this is very inspired by Dr. Marie Manthe, who uh, I was I absolutely loved attending her salons. So something that I did as a part of this project was to increase some cohesiveness within the unit, as well as give an opportunity for people to talk and unpack things that were on their mind at work. And so we held salons, which are, for those of you that haven't experienced them, it's just a warm gathering for connection, support, and inspiration. And there's this loosely structured conversation that happens. And the basic structure is that each individual shares something that's on their mind related to work. Then the group discusses the topics shared by the individuals, and then there's a conclusion with the key takeaways from the experience. I made sure to set ground rules at the beginning, and so that everyone remembers this is a safe space. And then because it was all coworkers, we didn't use any coworker names, or we made sure to not have this experience turn into like any sort of gossiping type situation. And I would say this was probably my favorite part of the entire thing. I felt so much more connected to my coworkers by having these conversations, and a lot of people really the valued the salons. Okay, so did a lot of things. I don't think I'll get to. So based off of these surveys, we created many interventions for them. And I wouldn't have been able to implement this volume of interventions if it weren't for the amount of buy-in that I had, and just a really great team that really worked hard and cared a lot about this. And also my managers were they just cared, and they really wanted this to be impactful. And so I think that made a big difference as well. But we did a lot of things, is what I'll say. That's what I'm going to say for this slide. So our resurvey and measure, make sure, check your progress. So part of the things that we measured were, my workplace has 5 well-being focus areas. And so we post surveyed being valued, meaningful work, personal enrichment, community at work, and a healthy work environment. So this graph shows the red means that the post-survey results were worse, indicated that they said it was worse than before. The gray area means it's kind of neutral. It's neither worse nor better. And then the blue indicates that the survey respondents said things were somewhat improved or improved substantially. So if you kind of think of this as a bell curve, you'll see that we are skewed on the blue side. So mostly there's blue here, indicating that there was quite a bit. So the net impact is positive on all of these areas. And the right side of this poster shows, or this graph shows the net impact, which is all positive on all 5 of these areas. So we had 47% improvement in being valued. The highest improvement was in a healthy work environment, which was a 57% improvement. So that was something I was really proud of and excited about. And then the next highest was community at work, with a 56% improvement. The other things that we surveyed were this idea of culture of safety. So do I feel free to speak my mind at work? And there was also a strong positive impact, which indicates that there was feeling free to speak their mind means that people are more likely to speak up and create, and that indicates that we had an impact on safety on the unit. And then down here, I'd like to be working at Mayo Clinic 3 years or more from now. There was also a net positive impact there, which means that there was an impact on retention. And then I'd recommend Mayo as a great place to work. So was happy about that. So then people had some comments, and the only thing I'll say is that there was a help to connect, and then it reminded people to assume best intentions prior to judging how someone's doing, and then being more open to give and receive feedback makes communication between staff members easier. So I think it all comes back to being really good at communicating with each other and the importance of assuming good intentions with your coworkers. So this is some of the team that I worked with, which just really appreciate and value all of them. So the final things that I'll say here is make sure you include everyone, look for your positive deviants, find ways to get feedback from those silent voices, and find and use the resources that already exist in your space. Okay. Thank you very much for listening.
Thank you so much. Are there questions?
I have one. Oh, it looks like somebody else has a hand raised. You go first.
No, I was just applauding.
Oh, thanks, Nicole.
You said early on in the presentation something about a bias toward action, and I'm interested in hearing a little bit more about that. How do you identify as somebody with a bias toward action, and how do we become people that are of that ilk?
Sure, yeah. So I think that I just, I rather than being stuck in the planning stage or being stuck in the idea of this seems too big to do, I want to address this thing that feels too giant to actually be addressed. I think looking at, but my bias towards action is what can I do now? How can I break this down into a small action that I can do right now? So I think that's why that in that example that I was talking about was, I think I mean, I created a survey with more than 100 questions, and that is really a big thing to do that I wouldn't have been able to do unless I had this grant funding to have time to devote to that. So for someone to want to do something to impact their work environment, you don't need to create 100-question survey. You could just pick something that you already know is a problem and just make a task force to address that. And I think that's how I see the bias toward action play out in this sort of scenario. I would also, yeah, absolutely. I would also say that I did not think that I was going to get this grant funding. And I just applied. I just did it. And I think that's also a little bit of that bias towards action. And I think it's really easy to not not believe that you could get or do something because I'm only, a bedside nurse or this or that. And, there's so much more that we're capable of if we just try, if we just do something, even if it's not exactly all. Thanks for asking.
This is Deb Cathcart, and I have a quick question on just as it relates to the ongoing sustaining of the work. So I kind of in the bio, it says that the project goes through July of 2025. So as you are thinking now about that handoff and next steps, what are some of the things you've thought about as it relates to that to keep the work going in the PICU?
Yeah, so for me, what I've been really intentional about is handing off as much as I can and also making policy changes. And so I'm really blessed to be in like the workplace that I'm in. There already existed several committees and things like that where the bedside nurses had some impact. And so I brought a lot of the interventions that we did to them. And I was like, how can you make this something that we keep doing? And yeah, that they really adopted those. One example that I can think of is a lot of the brand new nurses said, I really wish that there were more opportunities for me to keep learning. I don't feel like I know everything, right off of orientation, but then I don't know where to go when I have these questions, and sometimes they feel too stupid for me I feel afraid to, ask these big
Mhm.
questions that feel like I feel I should already know. So then part of our unit council, they created a smaller segment that was just an education committee where they had a brand new nurse as part of that committee. And then they also had an anonymous survey where people could pose questions that maybe they're not the only one that has that question, right? And then there's this, I think right now they've got an email that goes out where they kind of like show where you can find different policies and talk
Mhm.
are common. And I think they've also implemented what errors that are coming through as well, the incident reports.
Mhm.
So that also impacts what they include, and it's been really well received. So I would say that that's one thing that seems like it's a sustained impact because now it's been adopted by more than just, me saying this is important kind of thing.
A great project. Congratulations. So,
Thank you. Thank you very much. It was really a blast to do.
Sunita, are you continuing the salons?
So, yes, but sporadically. I think that's the one thing that I've kind of been struggling with on how to make it live live on past me because the problem is that Mayo has it already has these like structured debrief sessions, and it also has this training program called HELP, which is healing the emotional lives of peers. And that's actually really well established and it's funded, and it has people that are it's staffed and things like that. And there's a really cool training program on how to have these structured debriefs, which is not the same as a salon, but it's kind of in the same category. And so that is what makes it hard for me to make the salons live when it feels like there's something that already fills that, even though it's not quite. And I'm trying to make the argument for that it's a community building opportunity more than just helping with burnout. But yeah, I would say I don't have a good answer for. I have been continuing, but I was doing them every week during the funding period, and now I'm doing them about once a month. So, and I don't even know if I'll be able to keep, it might end up going to like quarterly. So, if anyone has any ideas, I will take them.
Well, it's kind of like yeah, a way to identify issues and kind of a check-in on how you're doing as a community, not about burnout, but about, how are things going? And, are there issues that we need to be working on or things that we would all like to learn or, you know, go over something that they've learned
Yeah.
and
I
then onboarding new people.
yeah, I think I the problem is that I just don't know how to everyone agrees that it's important, but then I don't have anywhere for it to live right now as a sustained thing. And I'm having a hard time getting people um to help with that piece. So
Not
that's
an uncommon struggle. I mean, that's a real thing, isn't it? I mean, that's just like we heard from another attendee here about sustaining any of these efforts. It's that maintenance is so challenging with
Right.
you know, when people decide that it has enough value to them. And I mean, I even think about Marie's salons that are, I had a friend ask me, so are you gonna take them up? And I'm like, that's not my plan. I might still choose to attend them if somebody else steps up, but it is kind of that who will step up and who will take that on, recognizing the value of that, like you were saying, community building and opportunity to talk about all kinds of things related to nursing. You know, it is inevitable that the people that step up will have to step back at some time. And we know that's true for Marie and others that have, like yourself, that have other things that clamor for attention and time. So yeah, how do we work towards sustainment of the things that matter? You know, I mean, I think about this group and how convenient it is that we can meet by Zoom and connect and talk with one another and never leave, never leave home to do it. And yet finding time to take another step and do something outside of this to build a sense of belonging within nursing and a sense of vision and mission in nursing. So just an open question, I guess. But I'm glad that you did, wow, weekly is a huge undertaking. So that you did it like that for a period of time to develop an appetite for it, I think is a really notable contribution. And I'm grateful that you chose to do that as part of the Thrive project, because I do think human flourishing does require connection, and that's one way to have connection make a place in our lives.
You could make the case for doing salons with leadership just by knowing that there are employee engagement surveys that are done periodically that are mandated, and doing them prior, you know, it's a way of keeping people engaged or knowing, having a sense of how things are going before they do those surveys that everyone wants to know the answers to. Building it into a structure that exists that's, you know, mandated kind of can be helpful, as long as it doesn't seem like, oh, you're just doing it to try to get a better score.
Mm. So we also have something called the Sunshine Committee, and so that they put on like social events, and I did try to see if they would be interested in running that, but I wasn't as successful. But I don't know. I'll see if I can think a little more creatively about it on how one of these, maybe the unit council or that Sunshine Committee would be interested in taking this on.
Sunita, this is Nicole. I just want to say first off, wonderful, wonderful presentation. Like, it's amazing to see such a fierce and young leader doing it. So kudos to you. But also, you know, I'm also at Mayo. You're at the NICU. I'm in the CVICU. This is a great presentation. Maybe you can come give on our unit at our coordinating council. And then maybe you can then maybe from our coordinating council give you ideas as well. I just think this is a powerful presentation, and this is what I do when I precept nurses, is the well-being and belonging, the bullying, everything that you talked about, I deal with on the daily. So again, wonderful, wonderful presentation, and we will definitely connect. So thank you.
Absolutely, yeah, would love to. I know I had talked to would love to present to your unit council. So yeah, we'll talk.
This is Deb. I have another, it's probably not a question as much as just, I guess, a pondering from being someone who has worked in management for a lot of years. And kind of looking at when we think about kind of the bullying and those, some of those behaviors that are pretty long sustained in nursing. I think it's one of the things that, as I was a manager and, and other roles within nursing, seeing that happen, it just always has me wondering, at what point can we truly break that cycle? Or will it always be there for some individuals? Is it just part of human nature? And that our hope would be that a number of people doing that lessens over time. But I hope someday we do have that breakthrough, that it isn't a primary issue on our units, because it does lead to a lot of issues around retention, how people feel like they're contributing, and are they valued, and do they have something to contribute to people? And you just think of all the issues around retention and support for one another. And I guess that would be one area that I would hope that we can really truly see that change. It'd be great in my lifetime, but I do hope at some point that that cycle is broken.
Yeah, I mean, me too. I will say that I think that what we tolerate, we promote, and I think something this big sometimes, to make it where you don't, where it's like a zero tolerance, ends up being where it feels like you would lose a lot of nurses, potentially. And I think, yeah, so it feels very complicated.
Mm-hmm.
Sunita, this is Allie. I just want to tell you that I'm really proud of you. You're doing amazing things, and way to just take it on, because it is a big problem, and it's so important that we all do feel interconnected with people, because we're doing such personal cares for our patients, and we're taking care of their families. And so it's not fair that we take care of all of them and then leave our buckets empty and not nice to each other, right? But maybe that is exactly why that happens, because we've given, and then we know that they're always going to be there, right? It's like blowing up at mom at the end of the day, right? Because mom's never going to leave you, right? Your coworkers are never going to leave you. But I love this idea of the salons, because there's so much protected health information. And, I could go home to my husband, or I could talk to a friend about what I experienced, but they do not get it. And so then you rely on talking to your coworkers, and then I love the idea of having a safe space to process through those feelings, because it's such high pressure work. And so having a safe place, yeah. Because if you go to the boss, then people think, oh, you're complaining to the boss, but you really just need a safe place to process through the experience. And sometimes people do leave you in bad situations, and you do need to give that feedback. But also then learning how to receive it too, right? And so I think that's another point. Every time you bring something up to someone else, you're teaching them giving them an opportunity to learn how to accept feedback. And then as far as where this should live, I think that you present it as a tool to nurse managers to put in their pocket, and it's up to them. So good work.
Thank you. Thanks, Allie. I really appreciate that. I'm gonna have to tell my mom that I saw you. Yeah. Allie used to work at the home care that my mom that owned.
Yeah,
But
Sunita, this is Julia. I just want to echo a lot of the sentiments everybody has contributed. This is a great presentation. I did put in the chat. It could be replicated in different settings. You've done the work, like somebody said. Doing that survey on weekly basis is hard work, time and everything. Even if you don't have the money to continue for sustainability, just find a way to keep it going because it's really needed. And I will also encourage you to find a larger crowd to, do the presentation because it's a topic that is very dear to a lot of us, especially nurses. Deb really said it rightly. I don't know when that chain is going to break. I don't know when, right? The topic said thrive. A lot of us are just surviving and not thriving because of the environment. So at what point are you gonna say, hold on? And sometimes too, you're just fighting people. You don't even know when people are saying, I'm here for you, and you just believe it. They are really there for you. But because of, a lot of things going on, you don't know what to believe again, So we have a lot of work ahead of us. So we continue to, move forward in a better direction. So thank you so much. Great presentation.
Thank you. I appreciate your words very much, and I would love to replicate this over and over and over again and share it with as many people as I can. So I will happily talk to, if anyone has suggestions, I will happily talk about this wherever I can.
This is Mary Tanner. I was wondering, let's see, I don't have my video on. I was wondering, would other healthcare professionals be using this phenomenon? Yes, we're talking about nurses. That's why we're presenting here tonight. But would other professionals, other groups be able to use this whole process?
I will share that, and I mean, it's not just, obviously, like physicians are not the only other care providers on the healthcare team, but I will share that the resident doctors as well as the consultants doctors that I worked with and our nurse practitioners, they were really involved and found these feedback tools really helpful, because I think there's a lot of difficulty, particularly in rounds in where I work, where there's just because residents are getting feedback all the time, and I think the consultants don't always realize that they're given it in ways that is not useful. Kind, and it's not beneficial. And I think these tools on feedback, that giving and receiving feedback, I think it helped give a voice to the residents to speak up, and then also maybe helped the consultants to, I don't know, be a little bit more objective about the feedback that they gave. So I think this is prevalent just because I think healthcare is so hierarchical. This idea of bullying and your value and how people are treated is prevalent far beyond just nursing. And and that's why this project was interdisciplinary, because it wasn't just about the nurses. Yes, the nurses, there was an issue that lived right within the group of nurses that work there, but it went beyond that. And I would say healthcare is a team effort. And so I would say this is something that I feel very strongly goes way beyond just nursing.
Oh, good. Well, thanks for the wonderful presentation. Gee,
Mhm.
what a job you've done.
Oh, I appreciate it. Well, it looks like it might be 8 o'clock, so I've used my time.
So much, Sunita. It was great. It's great. And thank you everyone too for attending. I mean, we had a great turnout tonight, didn't we, Kathy?
We did.
That was a great. So we know it's an important topic, and just a great job.
Appreciate it. Yeah. It was a pleasure to talk with all of you, and happy to connect if anyone's interested.
Thanks, Anita.
Thank you.
Yeah,
What a great job.
Thanks.
yeah. Have a great night.
Thank you.